Welcome to Pros from the Pros, the podcast where dentistry's top minds share their strategies, stories, and mindsets behind their success. I'm your host, Dr. Roxana Imanian. Each episode dives into the lessons, challenges, and breakthroughs that shape today's dental leaders. When you learn from the best, you become your best. You become your best. You become your best. You become your best. Welcome, Dr. Athena.
Thank you so much.
Good to have you on Pros from the Pros. We start off with an icebreaker question.
That's a good idea.
Yeah, so we're going to dive right into it. After a full day of all-on-X surgeries, does that count as a workout or do you still work out after?
Well, full arch definitely counts as my strength training. I just go to the gym after to make sure my scrubs fit and keep myself humble, that's all. But definitely full arch keeps you definitely fitted more than working out, for sure.
Yeah.
Especially the arms.
How often do you work out?
So I work Monday to Thursday for the most part, and I always go to the gym straight. So 4 days a week, I do strength training.
Wow, that's amazing. Do you have a trainer?
I do. I work out with a trainer. It's been almost a little over 5 years. So because I know at the end of the day, obviously, I'm super tired. So because I know that he's waiting for me, I hate to cancel. So I always push myself to go there. And once I get there, I don't even feel tired. So that's the only thing that I can do between work and going home for myself to take care of myself too.
Incredible. How long have you been doing dentistry?
Dentistry, I graduated dental school in 2017.
2017.
Mm-hmm.
Okay. And what first sparked your passion for implantology and all-on-X cases?
Oh, my mentor. So when I graduated dental school, I started working for about a couple of months and I hated bread and butter of dentistry. It just wasn't satisfying for me. I always thought I was meant to do great things in my life. And bread and butter of dentistry, as rewarding as it was not doing it for me. And then I was getting ready to look at other options, different residencies. And then I met my mentor, Dr. Sean, who I'm still working with. And the day that I met him, he was actually doing a full arch surgery. And I walked in and I looked at him. I was like, that's what I want to do. And then he said, okay, come on over. I'll show you all my trades. So that's how it all began. And I was fortunate enough to be able to work with two great mentors every day. They were with me every step of the way. They set my foundations right. So therefore I never felt discouraged to not want to do it because I had great foundation. I really take pride in that.
What CEs did you have to take in order to become very confident in this field?
In dental school, you can learn the basics of surgery, implant dentistry through dental school, some residencies, but there are not that many programs in the country that actually teach you full arch dentistry. I think there is one or two that I know of. I don't know if anything has changed recently or not. But again, I was fortunate because Dr. Sean, he started 4M Dental Implant Center and 4M Institute. So through 4M Institute, he was able to train me. So when I took the courses, obviously you're not ready to just jump into doing surgeries, but I did a lot of observation. I asked a lot of questions and I met great people outside of 4M too, where I could constantly learn from different people and basically build on my own skills. But I think there is no one course that can actually teach you everything that you need to know because it's definitely a broad topic. I think it's its own residency. And you have to be able to take multiple courses. For example, in dental school, when we were doing crown preps or restorations or fillings, we didn't learn them overnight or just by going to one course. We have to take multiple courses, we have to take exams, and we have to keep building on that knowledge. Yeah. It's the same thing. The mistake that most people make, in my opinion, is that they try to just go take one course, they start doing surgery, and they feel discouraged because they don't know everything that they need to know. So my biggest advice is to try to find different resources to learn from, not just taking one or two courses. It's an ongoing training, in my opinion.
Yeah, for sure. Is there a case that really challenged you and helped expand your knowledge and skills?
About just traditional large?
Yeah.
What challenged me was that first when I started doing surgeries, obviously I had to pick and choose simple cases. I never tried to do a case if I wasn't confident that I can do it. I was not going to take any risk because at the end of the day, I am delivering a treatment for a patient. I'm treating a patient and I want to do my best for that patient. And I had to pick and choose. When I started doing surgeries, I thought every day I was thinking, what if I go do the surgery and I cannot load this case?
Yeah.
Excuse me. What if I start doing the surgery? What if I don't get torque? What if I cannot deliver on my promise of giving the patient the teeth the same day or right away? So that was the biggest challenge that I faced. And to overcome that, I decided to learn remote anchorage. So I decided to learn pterygoid implants, zygomatic implants. And with the combination of all of these treatments, there was no case that I wasn't able to do. So that fear factor was completely eliminated when I learned more skills. So just knowing the traditional is not enough, in my opinion, to try to tackle every single case. But the more you know, even if you do not want to do any of those cases, but it will help you build that confidence. If anything, the traditional cases seem very easy to you.
Yeah. It could be very stressful.
Absolutely.
Just doing those type of surgeries. So how do you increase your bandwidth? In other words, how do you train yourself to, do more mentally, emotionally, operationally without getting burnt out?
I think my biggest key to success in full arch surgery was that I was working through my passion. Money was never my drive. And I genuinely enjoy doing surgery. Even when I was in residency, I liked open flap surgeries. I liked all my perio cases. I liked extractions more than I enjoyed, restorative dentistry. So I knew that's something that I want to do. And what helped me be passionate about it and never give up was the promise that I was giving to my patients, that I promise you I'm going to change your life.
Yeah.
So I made that my passion that would drive me to do the surgery. So no matter how tired I was looking at the end goal, which was the promise of transforming somebody's life.
Yeah.
And I never looked back. And every case is different. Yeah. Cases are challenging. Yeah. No case is just like the other one. Everything basically challenges you to the fullest. But I never let that discourage me because I had a bigger purpose by doing all of these procedures.
Yeah. Besides working out after you leave the clinic, what else do you do to reduce your stress and increase your mental strength to just, take on more cases and do more challenging surgeries over time?
But honestly, our job is stressful. My workouts are stressful. But the number one thing that has kept me going above all has been my happy home, basically. Luckily, I have a partner who has been my biggest support since day one that I started this journey. He's very fun. He's very funny. He's very supportive. He's very easygoing. Anytime I go home, that's my meditation. Yeah. Because I know that I can go home and I can switch my brain. I can have fun with my husband. We can talk about different things that's outside of the work. And he doesn't create a stressful environment for me at home.
That's amazing.
Yes, I think that's something that's being overlooked in general in all of our lives. Yeah. I'm very fortunate that I was able to meet him and I was able to have such a great support in my life that could keep me calm so I can get up the next day and push forward.
Incredible. Do you take any days off?
From work? Never. I was actually sick a couple of weeks ago and I had to take 2 days off for the first time, I think, in 20 years. And everybody was like, you must be on your deathbed that you're not showing up to work. And that's true. And again, if you're doing something that you like, you're not really working. So I show up every day and I kind of try to feel motivated. But if I take vacation, I only take time off, honestly, just to go on vacation. But I never really take time off to just stay at home and take care of myself. But luckily, I'm fortunate enough that I'm able to work just 4 days a week. Yeah. So I'm off Friday, Saturday, Sundays. Mm-hmm. Let's say on a Friday, if I'm off, I get up, I just do some cardio just to start my day fresh. I try to read a little bit because sometimes I teach and I try to stay updated and everything. So I try to use Fridays to catch up with all of the readings. I try to plan, the rest of the day just to go out with my husband, catch up with friends, because during the week, I really don't see anybody. I don't do anything. It's just work and workout. But I just try to honestly see how I feel like doing that day that could keep me happy and make me happy. But really nothing special. It's just basically.
I bet you find something work related to do.
Oh, so sometimes I literally open the schedule and I stare and I'm like, okay, what can I do to make this better? But
I have the same problem.
I mean, I think it's part of our job because you cannot, if you're dealing with human beings, if you're treating patients and people, your mind is always,
you're thinking about your cases.
So you think about the cases, you think about, how you can make things better.
Yeah.
What future cases you have. Like people are always on our minds because there are patients, but they're also human beings. So we want to be in our best possible version when we treat them.
Yeah.
So yeah, it's really difficult, especially if you're a business owner. So your work really never stops on top of everything else. So I'm sure that's the case for you.
I don't travel as much as you do because you travel for courses. And what does a typical week looks like behind the scene when you're traveling to teach?
Usually most of the courses are Friday, Saturday, Sundays. I fly out right after work and then I just show up the next day for teaching. I usually prep a little bit more on the flight because that's the only time that I can be disconnected and I can actually focus on the course. But I never really take time off to just accommodate the teaching. And again, for me, teaching has always been my passion. If I were never to get into dental school, I wanted to get a PhD and I wanted to teach in university. So that's also another passion that I always had. And therefore, that's not really part of the job or anything. So if I'm traveling, if I work and then I travel, I come back to work on Monday, that teaching portion is basically my time off from work. And that's something fun that I have done for myself.
I love that.
So it doesn't make me tired at all. So
yeah. As one of the few keynote speakers in implantology, how did you make the transition from clinician to educator?
I started doing surgeries for a couple of years and I decided that I can fulfill my other passion, which is also teaching. Luckily, we have an institute and I was able to basically find what interests me within the institute and started teaching that. And that basically ignited my teaching journey. And once I started doing that, I started collaborating with other institutions, other organizations. And since then, I just embarked on this journey and it became my passion outside of work. So.
Yeah. And you mostly teach all on X surgeries?
Yes, it's mostly about all on X and implantology. Yes.
Wonderful. What part of teaching brings you the most fulfillment?
What part of teaching brings me the most fulfillment? The fact that I can make a difference in somebody's education, in somebody's life, and that's not just the patients, but clinicians also, because there are so many passionate people out there, they just don't know where to start. And I know that the power of mentorship is really strong. And I think it's part of it's a missing puzzle in this journey of learning and education.
That's so true. In all on X cases, usually patients show up with terminal dentition, with lots of infections in their mouth, teeth infection, gum infection, bone infection, and they have waited a long time before they were seen. We know now that oral infection can cause serious health effects. Why do you think patients wait for a long time before they get the care they need?
I think when it comes to oral health, unlike anything else, anywhere else in our body, we see the symptoms or the negative effects kind of later when it's too late, when there's infection already, when we cannot chew, or when we have major issues. But for example, if you have, I don't know, if your arm breaks, if you have a heart issue, if there are other issues, you see the symptoms and then you go and you address them. But I think we often overlook the importance of oral health. There's so much research out there relating the oral health to systemic diseases. And I think when it comes to terminal dentition, if people know that, well, let me go back. I think a lot of people have terminal dentition mostly because of phobia, because of access to care, or because they think they have to go from doctor to doctor to doctor and they're overwhelmed with by all these options that are available to them. But when you reach a stage where when we call it a terminal dentition status, All on X is a great solution for that treatment because it's one stop. You can get it done. You can literally get the best treatment in fewer number of visits, and you can literally change your life in 24 hours, I say.
Yeah.
And if people know that this treatment can actually help them first regain their oral health and also positively affect their systemic health, I just don't see any reason as to why people would not seek this kind of treatment.
And they neglect it. Yeah.
Exactly.
That's so true. Beyond the physical transformation and the positive health effect, what are the emotional transformations that you see after completing a case for the patient?
Oh gosh, that's almost every day.
Yeah.
When I lecture, I have this video that I show in my presentations, and I also always tell my patients when they're emotional at the consultation, they're crying, and I tell them nobody cries on my chair. They can only cry afterwards when they see their teeth, and that's only tears of joy. And I'm fortunate and lucky enough to be able to experience that literally on a daily basis. And that emotional effect is almost 100% every single time with every single patient.
Are there any patient stories that constantly remind you why you do what you do on a daily basis?
There are so many of them. There is one that I can think of in particular, and I always give that example. So many people might have already heard that. I had a patient who came in for a consultation. This is almost 6 years ago. And he was very shy. He was not talking to anybody, yes or no answer. And he had severe gum disease. I barely knew anything about him. We just knew that that's what he needs. And I was able to provide him with the treatment. And then after we finished his procedure, every time he was coming back, I could see that as a person, he's evolving. He was becoming more personable. I actually saw him at the airport. I was boarding on a flight and I saw him with all of his musical instruments. And it turns out that he was a great musician. He was going to the East Coast to perform at a concert, I think, at a time. And I could see the spark of joy in his voice, in his eyes. And I could tell that, oh my God, I did this for him and I was able to change his life. And that's the most rewarding. I don't think there are not that many procedures in dentistry that can actually give you this level of satisfaction.
Yeah.
And All-on-4 and All-on-X surgery is definitely one of them. And I want to be able to do this literally for the rest of my life. And I would not change it with anything else.
Yeah, going from dentures to having full set of teeth that actually stay in and gives you 70% chewing ability back. Is that right? What's the statistic?
I don't know the percentage.
Okay.
I don't know that number, but definitely compared with the denture, oh my God, I can't.
It's a huge difference.
It's a huge difference.
For sure. We often hear that about 1/3 of dentists in the US are women, but that statistic doesn't reflect All-on-X. In your perspective, what is that ratio like?
I think in the world of full arch, there are definitely less women compared with men. It's definitely a male-dominated field. But I think it's changing, actually. I remember 5 years ago, if I were to go to a conference, I would only see men, maybe a handful of women there. But now I see more and more people feeling encouraged to want to enter this field. And again, I get this question a lot when I go to my courses or conferences. A lot of women actually approach me because I'm honored that they look up to me and they really are trying to look for advice on how they can, reach where I am. And that's part of my mentorship journey that I try to take on, more students, more people who are trying to find their way within this field, especially girls. My advice is that even though it seems like this is a male-dominated field, but you cannot believe how supportive all the male surgeons are in this field. My mentors were men. The people that I teach with, that I work with, that I travel with, they're all men mostly. And honestly, they have been the most encouraging. They never try to intimidate me. They don't look at me as a lesser surgeon or person. They don't even look at me as a girl. They just know that I can actually go toe-to-toe with them. And that actually has been one of the greatest reasons for my success, because I never felt like I was different. I never felt like I had to work especially harder to be able to matter in this field and to be able to show my talent. And anybody that I've encountered with and that I have met with has been really, really nothing but encouraging and supportive. So there's no reason to be afraid.
The door's open.
The door is open, exactly. And then if people, or if anybody, girl, boy, male, female, doesn't matter, if this is something that you truly enjoy, that if you see, first of all, you have to like it. You have to be ready to be challenged. You have to not be afraid of setbacks. You have to be able to invest in your education and learn it the right way. If you think you have that drive and you want to do it, there's no reason for you, I'm not going to mean you in general, for people to not want to do it. Because again, as you said, the door is open.
Yeah.
And it's good that I see more and more people are interested in wanting to do this. So
I think for a lot of people, it could be that, when complications arise from doing these cases, most people don't know how to manage it. What's your approach to prevention and management?
I'm so glad that you asked that question, because anytime I have a student, for example, they come take a course, they're a little bit slower trying to, embark on the journey and trying to just find a case and do it. Or they do one case, sometimes they try to give up, but that's my role as a mentor to try to encourage them and show them the right way. And the answer that I always get is that, oh, I'm scared. Or what if I face a complication? Or how am I going to manage the complications? And I recently actually just gave a lecture, and I named my lecture The Bright Side of Complications. Complications are there. All of us are going to face it at some point. But how we can look at the complications is by changing the perspective. If you know that the complications are there, the more you learn about them, the more you hear about them, the more you ask about them, you're going to recognize them, and hopefully you can avoid them. So I think the first step to avoiding the complications is recognizing it and doing every step right. If the complications happen, then they happen. Anything you do, if you were to do a crown prep, you might always hit a nerve. If you were to do a root, you might end up extracting a tooth. So every procedure has a complication. Obviously, the more risk you take, the more complications you're going to face. But honestly, to this day, thank God, just by taking the right steps, I haven't really faced any major complication that I wasn't able to handle. And I think that, number one, learning the basics right. Don't try to jump the steps. Don't try to just take a course and just immediately run into doing a live patient surgery. No. You have to learn the basics of implant dentistry. You have to learn the basics of implantology, full arch dentistry. You have to practice it on a cadaver. Then you have to do surgeries under mentorship. So if you have a mentor or somebody that can be there to hold your hand, then you're going to start building the confidence. You have to invest in that. Same thing in dental school. When we were doing the procedures, we would take practical exams. Then we would go into the clinic, and then we would do it under the mentorship or supervision of a faculty. And once they were sure that we can actually do this on our own, then, okay, you would graduate, you would do residency, and then you would go into doing the procedure on your own, have your own office, working as associate. It's the same thing here. So if you build the foundation right, that's the major fear of complication, I think, is going to be eliminated automatically.
So when you think about the future of dentistry, what genuinely excites you the most?
What genuinely excites me the most, honestly, is all the advancement. I think we're going at a really fast speed towards advancing our field, which is amazing. I'm a positive person. I always look at the bright side of things. And as much as it's rewarding to be able to do all of these advanced procedures, but the one thing that I'm not happy about, or the one thing that scares me, is that people are doing things without being ready for it. So I think as a whole, as a field, as a profession, we have to still think that we are treating people, we are treating human beings. And any work that we do is actually our business card in somebody's mouth, literally. And it just saddens me sometimes. I see that people are doing procedures, and then right off the bat, when I look at the x-ray, when I look at the outcome, I see that the person who did this procedure, unfortunately, they didn't know what they were doing.
Yeah.
So I think if we could kind of push the brake and try to take on the cases that we're able to do and manage, we're going to face a better future in dentistry overall. So I like to kind of address this, and I don't want us as a profession to forget that we are building our profession. We are.
Absolutely.
Every single one of us are playing a role in the brightness of the future of the dentistry. But if every single one of us follow the right steps, we can make sure that this field goes forward with a great future. But if we try to cut shortcuts, if we don't always try to be the best version of ourselves, then we're going to fail our colleagues, we're going to fail ourselves, and we're going to fail the future of dentistry.
That's true. And with the digital advancements, it's becoming more precise. And do you use surgical guides or you do freehand?
I always do
implants? Even your zygomatic implants are freehand?
I've never used a
Wow.
guide. I think honestly, for certain cases, or if you think that you can do guided surgery, it's great. But you have to be able to do it freehand first. Guides, sometimes they may not fit, they may not work. Guide cannot predict the quality of the bone. You can face, surprises during doing the surgery. So if you have to abort, remove the guide and still move forward with the surgery, if you do not know how to do it freehand, then basically you're screwed. So I think you should do freehand before doing guided surgery. Yes, there are some cases if you think that would help you, avoid complications or avoid certain anatomical features and do a better surgery, absolutely, why not use that? But you have to be able to do freehand. Yes, absolutely.
Okay. That's good to know. That's brave. Okay, so when you think about the future and in a few years from now, if you look back, what's your proudest moment about the work that you do? Is it the education or being the clinician that you are, or all of it?
I think my proudest moment or the proudest thing about myself is that I always try to stay humble. And I'm a forever student, even though I'm an educator. But every day I try to learn. I try to surround myself with the best in the field. I try to ask uncomfortable questions. I never say I know it all, because especially if you're an educator, you have to be able to critique your own work before criticizing other people's works. So I always try to stay on top of my education. No matter how much I know, there's always a new paper that's coming out that I read and I try to learn from. There are always newer ways of doing things that I try to stay on top of and learn. And I can never say that I know it all. And I think I'm proud of myself for not having that kind of ego where I don't want to learn from anybody or I don't want to learn from my own mistakes. So I think that's what I'm proud of the most.
That's awesome. What's the legacy you want to leave behind?
The legacy that I want to leave behind is that, I think that I learned a trade and I tried to do it to the best of my ability, and I was able to transfer that to other people to do it too. I'm sharing all of my tricks. I'm always trying to, even if I have a complication, I always share it with other people. And I kind of like that to be my legacy, that I was able to change other people's careers. I was able to motivate them and inspire them to kind of get out of their comfort zone and to try to be the best version of themselves every single day.
Yeah, passing your knowledge down
Absolutely.
to people. That's awesome. So good to have you on the podcast.
Thank you so much.
Yeah, our audience will love this episode.
Thank you so much
Such
for
an honor to have you.
Thank you. It's such an honor for me to be here. I love that I could have this platform to be able to share little bits and pieces of my experience. I'm always open. I'm always a text message, an Instagram message away. People reach out to me all the time trying to, find their way into the field. And I'm always available. Even if I'm on vacation, I'm always responding to people, to my patients, to office.
You're always working.
I'm always, because again, I don't look at it as a work.
Yeah.
I definitely look at it as a passion, and that's my motivation and my drive. And those who know me, they know that I'm always available to be able to help them. And that makes me truly and genuinely happy.
Beautiful. We're so lucky to have you.
Thank you so much.
Thank you, Athena.
Thank you.
Thanks for tuning in to Pearls from the Pros. Subscribe for more conversations with dentistry's top minds and stay connected for upcoming episodes with leaders who inspire growth, excellence, and impact. Until next time, keep learning, keep growing, and keep becoming your best. Your growth is your greatest legacy.